Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined today, of course, by Governor Janet Mills. I'd like to start by providing an update on the COVID-19 situation across the state of Maine. We sadly begin today's update with the report of yet another individual in the state of Maine who has passed away with COVID-19. This person was a woman in her 80s from Sagadahoc County. And as always, all of us, offer our deepest condolences to the family of this woman during their time of grieving. As of this morning, the Maine CDC is reporting 586 cases of COVID-19 across the state. That's an increase of 26 cases since yesterday. We're also aware of a total of 111 hospitalizations. That's an increase of 6 since yesterday. Thanks to the work and partnership that we have had with the hospital systems across the state, we are also able to report that per the hospitals, there are currently 20 individuals in the state of Maine with COVID-19 in intensive care units. There are also 37 additional individuals with COVID-19 who are also hospitalized but not in intensive care, making a total current hospitalization of 57 individuals in Maine with COVID-19. I again would just like to take a moment to thank the hospitals for working with us to be able to report that data so that we in turn can report it to you. Sadly, as I've noted, there have also been 17 deaths in total since Maine CDC began working with COVID-19. And there have been a total of 246 individuals who have recovered, an increase of 44 since yesterday. This morning, Maine CDC epidemiologists reviewed the latest with respect to community transmission and have determined that community transmission is now occurring in Penobscot County. This is in addition to 2 other counties in which community transmission had already been detected, Cumberland and York. So we have now confirmed community transmission in Penobscot County. All of these numbers, while very important, don't yet paint the full picture of the impact of COVID-19 on Maine people and those who care for them. We also know that home health professionals, hospice nurses, and others whose work takes them into the homes of Maine people are playing a valuable and indispensable role in this outbreak right now. These skilled home health providers include physicians, registered nurses, occupational and speech and physical therapists, social workers, and home health aides. And they're joined by hospice teams that include physicians, nurse practitioners, registered nurses, social workers, and chaplains. Each of these individuals is on the front lines of the front lines. And I thank them for their quiet, powerful heroism, going into the homes of individuals who may be sick and providing care to them in these difficult times. I'd like to provide an update on 2 situations that we are dealing with and working with respect to long-term care facilities and COVID-19. The first is the Tall Pines situation that we discussed yesterday. At present, there are 22 cases of COVID-19 affiliated with individuals at the Tall Pines facility in Waldo County. Yesterday, Maine CDC staff delivered approximately 72 hours worth of PPE to the Tall Pines facility, and we're currently working to pull a larger order to equip the facility for the next several weeks. We've also tested each and every individual in the facility for COVID-19 and are analyzing those results right now. We've been working very closely with the facility to make sure that there are open lines of communication such that any need or request that they have can be answered by Maine CDC or Department of Health and Human Services staff as quickly as possible. We continue to hope that and work with the facility to ensure the health and safety of each and every one of the residents and the staff members there. I'd also like to provide some information about a separate outbreak occurring at a facility in Augusta, the Augusta Rehab facility. At present, Maine CDC is aware of 4 residents of the Augusta Rehab facility who have tested positive for COVID-19. We, as we did yesterday with Tall Pines, are currently delivering an emergency order of personal protective equipment to the Augusta Rehab facility, and will continue to work with them from an infection control perspective, a PPE perspective, as well as a clinical epidemiology perspective, all with the goal of keeping all of the residents and staff as safe as possible from COVID-19. I'd like to turn next to some updates on the laboratory testing front. Yesterday, I noted that Maine had been recently informed by the federal government that what we were initially told we would be receiving from Abbott Laboratories and their rapid point-of-care test is not what we actually received. The federal government initially told us that we would be receiving 100 test kits, but then later changed course and told us we would only be receiving 5 test kits. That sent us back to the drawing board. But we were also aware that Martins Point Healthcare had, even though they hadn't asked for it, also received a high number of test kits. We started having very productive discussions with Martins Point, and they are, I'm proud to report, are going to be able to donate 5 of their test kits to the state of Maine, effectively doubling our capacity to perform rapid COVID-19 tests across the state. These test kits will be used in one of the highest concern populations we have. Those are individuals who have a high risk to being lost to follow-up, likely because they may be experiencing homelessness. What this means is that we will be able to work with healthcare providers to double the capacity of rapid point-of-care tests that we have and return results to physicians who can then immediately provide for safe isolation for people who may be experiencing homelessness, as well as other essential wraparound services. I'd like to take a moment again to thank our colleagues at Martins Point Healthcare for this extremely generous donation of these 5 test kits, and commend them for their collaboration in working with the state of Maine as we confront this crisis. This is exactly the sort of public-private partnership that makes me proud to be working in Maine right now. Finally, I'd like to just report on one other receipt of donation. Our colleagues at ND Paper recently donated 3,000 Tyvek suits and 40,000 surgical masks to the state of Maine. That shipment is en route right now and is expected to arrive quite soon in the next coming days. And I'd like to just thank our colleagues at ND Paper for this generous donation. I want you to know that this donation will go again to protecting healthcare providers across the state and allowing them to remain on the front lines, continuing to provide care for all people in Maine, COVID positive or not. So with that, I'd like to turn things over to Governor Mills. Thank you very much, Governor.
Thank you, Dr. Shah. And along those lines, I want to thank all the other Maine businesses who've turned to and decided to make masks and other PPE. Everybody from LL Bean and New Balance to American Roots, so many companies across the state and their employees. I want to thank them too. So along with that news from Dr. Shah, as you know, last night a spring storm brought strong winds and heavy snow, and it downed tree limbs and caused power outages all across the state of Maine. Those power outages are still there. More than 250,000 people were without power this morning. Nearly a third of the state's electric utility customers. The children in my neighborhood found it to be very good snowball weather. But in the wake of this storm, I've directed Maine Emergency Management Agency to work with our electric utilities and to secure mutual assistance from other states and New Brunswick, and to expedite the restoration of as much power as possible, as quickly as possible. Given the COVID-19 epidemic, I've asked them to prioritize hospitals, healthcare facilities, and food distribution centers and bring them up to speed first and turn their power back on. Those without power who may be watching this, I want you to know that restoration process likely will take us into the weekend. I know this is frustrating to hear. It's frustrating to be asked to meet new and seemingly never-ending challenges with courage, patience, and compassion. But I ask you to stay the course, stay patient, stay courageous and compassionate. I know everybody's kind of tired of being cooped up at home, tired of working from the front lines away from family and friends. Kids might be tired of not being in school. I don't know. Everybody's tired of wondering how long this will all last. It's okay to be tired and frustrated. And in difficult moments like these, with these burdens, when they feel almost too great to bear, I think about my 4-year-old granddaughter. Her favorite movie is Frozen 2, and her favorite line from that movie is, "Do the next right thing. Do the next right thing." So what keeps me going during these times of Passover, Ramadan coming up, Good Friday, and Easter coming up, what keeps me going is my faith in you, the people of Maine. My faith in knowing that no matter the difficulty, no matter the stress, no matter the challenge, Maine people will do the next right thing. Wednesday evening was the beginning of Passover. Today is Good Friday, Sunday, Easter. Later this month, the beginning of Ramadan. And I'm thinking of people of all faiths this week and this month, and about the people of Maine every week. So today I suggest call a neighbor, make sure they're okay. Thank our frontline workers. Hug your kids who are missing their friends and their teachers and their schoolmates. And continue to stay at home to beat this virus. Be kind. Love one another. I'm speaking to you today also as a widow, a mother, a grandmother, a friend. I know there is someone you know who's waiting to hear from you right now. Maybe they're older than you, maybe it's an uncle or an aunt, a grandfather, grandmother, a neighbor, someone who's in assisted living, who's waiting for the phone to ring, someone you used to snowmobile with, or somebody you used to go fishing with, or play cards with. Tell them now you want to hear them tell you their story. Tell them that you want to hear about the Korean War, their experience in Vietnam, or what they remember about their wedding day. Take advantage of these moments to learn the histories of other people. Recently, my niece had a homework assignment. She was studying the Vietnam War. She took her notepad out and she called my older brother and talked with him for 3 hours about what it was like to be in the Navy during the Vietnam War, to be patrolling the coast of Vietnam, how many shots they took, how many people they saved. Don't miss this opportunity. There may not be another. Don't let this moment pass you by or pass by your children or your friends. Make the call. Even if it's someone you've lost touch with, someone you once offended, they need to hear from you. Do the next right thing. Today, we're all in this together. And today, now speaking as governor, I want to provide you some updates. There's an echo here. Somebody's calling in. That's all right. Today, I'm pleased to announce that the United States Department of Health and Human Services has said that healthcare providers nationwide are going to receive $30 billion in support to support their hard work fighting this COVID-19 pandemic. Over 1,681 Maine healthcare providers are receiving nearly $146 million in the next few days. I want to thank the Maine congressional delegation, all 4 of them, for helping obtain these critical funds through the CARES Act last week. Funds that'll support our hospitals during this time of unprecedented uncertainty and financial instability. This new federal funding will help safeguard our healthcare system, which is one of the sectors that is hardest hit by this pandemic. And our small businesses and employees are also hurting. A record number of Maine people have filed for unemployment in the last 3 weeks. The last 3 weeks, 76,000 people have filed for an unemployment claim here in Maine. By comparison, 35,000 people filed for unemployment in all of 2019. So it's more than doubled just in the last 3 weeks, surpassed the entire amount of last year. So on Monday, and this is a national phenomenon, as you know from watching the news, on Monday, the Maine Department of Labor asked people to start calling based on alphabetical schedule, alphabetical order. People with last names starting A through H, please call on Monday. People with last names starting I through Q, please call or go online on Tuesday. People with last names between R and Z, please contact them on Wednesday. Thursdays and Fridays are reserved for anyone who was unable to call earlier in the week. I cannot imagine what it's like for so many people to have just lost their job, waiting tables or doing service work in the hospitality industry or otherwise across the state. But Maine people are following that schedule, and it's helping alleviate the burden on the phones and the computers. We had only 50,000 calls to the Maine Department of Labor on Monday instead of 250,000 calls one day last week. There's still wait times, and I ask for your patience. I plead for your persistence and patience. But the phone lines are getting better handling that call volume, and we're also expanding our capacity to field and process these claims. We're working now with a Maine-based contractor to hire 100 more people. They're already being trained to answer calls for at least the next 6 months. And we're working on updating the state's processing systems in the wake of all these federal changes in the unemployment laws as well. So Maine people can get what they need, what they deserve, what they're eligible for, including the additional $600 in unemployment that Congress just passed. I know that not being able to get through to anyone to answer a question or to file a claim is very frustrating when you've been out of work, and it's no fault of your own, of course. The Department of Labor will continue to work day and night, all weekend, to respond to the urge and calls, the surge in calls, and the federal changes that are coming at us every day, so that every Maine person gets every benefit that they are eligible for, every benefit they deserve. Lastly, I just want to leave you with a picture of where we are compared to other states on the impacts of COVID-19. If we look at our numbers on a per capita basis, taking into account the size of population compared to other states, Maine ranks 34th lowest in the nation and lowest in New England right now for the number of COVID-19 cases. We're 34th lowest in the nation for the number of deaths due to COVID-19, although every death is a tragedy in our books and one which we regret. We are 7th highest in the nation for the number of people who have recovered from COVID-19 and 14th highest in the nation for the number of tests conducted for COVID-19 per capita. These numbers may seem encouraging. Well, what's the problem? But I'm not offering them to reassure you. They can get better, these statistics, or they can get worse. It's up to you to decide. It's up to every one of us. Do your part. Stay apart. I'll say it again. Stay home and go out only when necessary. When you do, stay 6 feet apart from one another as much as you possibly can, and wash your hands often for 20 seconds at a time. Be kind, help save a life, do the next right thing. Finally, today, Larry Lord, the Farmington hero who ushered people out of the LEAP building in Farmington just before it exploded last September, he arrived home today. He arrives home after months and months of rehabilitation, and he still has a long and difficult road ahead. But today, as we clean up our roads after this storm, as we restore power over time, as we stay apart to stay safe, let Larry Lord's heroism and perseverance remind us that courage and kindness like his exists, and with that courage and kindness, we can and will not merely survive, but overcome and thrive. God bless you and keep you safe. God bless the state of Maine.
Great. Thank you, Governor. We've got a full list of our colleagues from the media, so we will start today.
How long ago?
A few minutes.
Oh.
Put this on the speaker here. Hopefully they can hear us.
Want me to repeat those last 5 minutes?
Yeah.
Just the folks on the phone couldn't.
Oh, okay.
So they could hear you from the live stream, just with the phone system.
Okay.
It's today.
Is the stream still going? Okay.
The stream is still going.
Well, so to everyone watching, there was a bit of a technical hiccup with the dial-in line for our colleagues in the media. So we are getting them back on the line and should be able to take questions from the media very, very shortly.
Oh, it'd be terrible if we lost them. I'd feel terrible.
Okay.
Commissioner Lambrew is here as well.
Yep. Okay. We've got our colleagues on the media, and today's first question goes to Don Kerrigan from News Center. Go ahead, Don.
Yes, thank you very much, Dr. Shah. Two questions. One is about congregate care, and hang on a second.
Congregate care.
Sorry, about congregate care, and are congregate care facilities required to inform their patients, their families of patients, that COVID-19 exists in that facility? That was a question we had from a viewer. And I do have a separate question after you answer that, if I can, please.
Okay, thanks, Don. Don's first question is about the recommendations and requirements that long-term care facilities are asked to abide when they have outbreaks of this nature. One of the first things when Maine CDC becomes aware of an outbreak, one of the first things we provide to any long-term care facility is a packet of information about how to go about communicating with stakeholders. And in that packet of information are template letters that we strongly recommend that they use on their own letterhead to send out to all residents, all staff, as well as to the families of all residents to communicate about what's going on and how they can get additional information.
The other question, Dr. Shah, if I may, is about Maine and New Hampshire. We look and see the 5 most populous counties in the states, the 3 in New Hampshire, 2 in Maine, have well over 1,000 confirmed cases between them. These are also where the most people are, understandably. But does this fact that all of those counties are basically contiguous, does that present a larger threat and a larger problem of greater transmission of the virus?
So Don's question, his second question, is about the contiguous counties between Maine and New Hampshire and the fact that they are both the most populous and thus not surprising that they have the highest number of cases. How do we think about that from a public health perspective or an outbreak control perspective? Don, and I think the bottom line there is that it really underscores what Governor Mills said, which is the need for everybody to stay inside, especially those who live in the most populous parts of Maine or New Hampshire. The higher the population density in the area you live, the stronger the imperative it is to stay inside and reduce the likelihood that you come into contact with anyone who might give the disease to you or to whom you might give the disease to. Next question goes to Kate Koff from the Ellsworth American.
Thank you, Dr. Shah. My first question is for you. You mentioned yesterday that we've seen a number of nodes of spread within households, and I know that in some areas of the world, they've aggressively kind of isolated anyone who's positive away from their household. And I'm wondering, is that something that's on the table here? And do you think it would be effective in helping prevent the spread?
So Kate's question is about something we discussed yesterday, which is an epidemiological finding that's held true in Maine and across the country, which is that individuals who live in the same household as a confirmed case are at the highest risk. And Kate's question is about the advice that we give and what we might do. One of the first things that we do when we've detected a case of COVID-19 is our disease detectives ask who else lives in the household and to what extent is it possible for that individual who has tested positive to isolate themselves within the household. And what we've seen in Maine is that it's been possible. We've seen and heard reports of individuals who have been able to stay upstairs in a bedroom and have food dropped off at their door of their bedroom and thus avoid the likelihood of infecting other people in the household. It's a challenge. We fully recognize how hard it can be to be cooped up in a house, let alone in one room of a house. But for those who are able to do it, we know that it can save other people in the household from getting ill.
Thank you, Dr. Shah. My second question is for Governor Mills. I'm wondering if you can tell us, is the state paying for the use of the cell phone tracking data? And is there anybody overseeing the use of that data?
We are not paying for the use of the cell phone tracking data. It is obviously de-identified as well. And what was the part? Are we using it? I'm sorry, we're using the raw numbers.
No, is there anyone overseeing it?
Overseeing it? In what sense? We're just receiving data that simply says what the traffic, or the reduction in traffic is, travel, really. It's not, it's not identified at all.
And Kate, I'll just add, it's publicly available data, not proprietary, not specially made for the state of Maine, and definitely not collected by the state of Maine, rather collected by the cell phone companies. Next question is to Brad Rogers from WGME.
Yes, I saw the governor wearing a mask today as she was walking in. It seems like if you're supposed to stay out of the public as much as you can and not want to get the virus, the masks aren't they more of a good idea now? Are you rethinking the way you're thinking about it, Dr. Shah? And also, if you could just talk a little bit more about the Augusta Rehab Center, too, any other information you know about that.
I think he's asking about whether masks have become sort of a good idea. I think they've become a common practice. But I have not been going out in public, so I really haven't used one. I'm basically home alone, cleaning my room at night, channeling my mother. She's whispering in my ear, clean your room, clean your room. But so I have not had occasion to wear a mask very often. I think it's become more customary as a super precautionary move. And the second question was about the Augusta Rehab. What was your question about that, Brad?
Yes, I was just trying to see if Dr. Shaw has any more information about, how they may have got it or what else you can tell us about that.
So Brad's second question is about the Augusta Rehab facility. Our investigation is underway there. We're interviewing folks to see what the travel patterns in and out were and how it might have been introduced into the facility. It's too early to comment on that right now, Brad, but please know that our disease detectives are working on that to try to get a better handle, not just to protect this facility, but to continue giving advice to other long-term care facilities. Indeed, the Department of Health and Human Services has been working with long-term care facilities, and there's more information about that work coming out very soon. The next question is to Talia Clark from WMTW.
Hello, my question is for Governor Mills.
Yes.
I wanted to know, you did mention power outages and how they affect Mainers, but I'm just wondering, what about those Mainers who stopped up on food due to prepare quarantine, and we now have to throw out spilled food? What do you have to say if they need to enter the grocery store and how Mainers are going to be dealing with this?
I'm sorry, something about corn seed and grocery store.
Can you hear me now?
Oh, there, that's better, yes. Could you ask?
Sorry, I had you on speaker. Okay, so my question is about the power outages. And how
power
Mainers are
outages.
dealing with
Oh.
it. Yep, with the viral outbreak. And those Mainers who may have stocked up on food because of the virus and preparation of quarantine. And, what about those folks who are going to have to throw out spoiled food with limited entry to grocery stores? What do you have to say?
Groceries. Well, we've asked we've asked MEMA and the utilities to prioritize food areas, grocery stores included, as well as health facilities. But if I were home, I'd be getting my old camper freezers out and putting food. I wouldn't be opening my refrigerator for as little as possible. But I think Maine people know how to deal with this because they've dealt with outages before. And fortunately, the temperature's still down some. Oh, Commissioner Lambrew has some advice here.
Sure. I will just add on the issue of food. We did announce last week that the federal government is bringing or giving Maine $11 million more to increase our food supplement program. That will help. We also have been working with our food shelter, for food banks, our different partners and communities to make sure that we have adequate food. That was before the storm. That should help in the storm. The funding for our food supplement should be coming next week.
And I have one more question for the governor. If the curve is flattened in the state, with the stay-at-home order and it's been lifted, what will happen if the numbers start to go up again in the future?
Thanks for the question. She's asking about if the curve is flattened and we lift some of the restrictions and then the numbers go up again. That's kind of speculative, and that's exactly why we're not lifting the restrictions right now, I guess I have to say, because we don't know that the curve is flattened. It takes a long time to analyze the curve and the progression of this infection, and we're not safe right now. We're not safe to lift any of the restrictions that were imposed. We've got to stay the course, stay apart to be safe in the long run. There's no timeline on this disease, on this infection, this virus. There's no timeline for lifting the restrictions yet. That's why I'm cautioning patience, courage, and compassion.
Next question is to Colin Ellis at the Portland Phoenix.
Thank you, Dr. Shah. So there's been a lot of efforts made to make grocery stores safer for members of the public. I was wondering if there have been any more discussions or perhaps plans going forward to make them grocery stores, similar stores, safer for those who still have to work there.
Protections for people who work in grocery stores? Is that what you're asking?
Yeah, if there's been any more discussions or further plans to make them safer.
It has been discussed. I think I received something last night from a union representing a lot of grocery workers. I haven't had a chance to analyze it yet or to determine whether it's appropriate to incorporate that into an order or simply sit down and talk with the Grocers Association and see what they're doing and make sure they do as much as they can. Haven't had a chance to do that yet today.
Thanks, Colin. Next is Amy Brown from WERU.
Thank you, Dr. Shah. I have two questions. The first is, what is known about the rate of false positives and false negatives with the tests that are being done? And then we also had a listener wanted us to ask if the traveling salesperson that you spoke about yesterday that so many of the positive symptoms were traced to, is someone who was asymptomatic while they were doing that traveling? Were they able to spread it that much while they were asymptomatic?
Okay, so Amy has two questions. The first is about the false positive and false negative rates of the tests that are being done. And I'm going to just speak about the testing that's done at our laboratory here in Augusta. That test uses a DNA system, or in this case, an RNA-based system, to really look at the genetic fingerprint of this virus and compare it against a sample that we get from the US CDC. And the accuracy, the precision of this test is extremely high. What that means is that if it turns out to be a positive, it's a positive. And if the result says it's a negative, it's a negative. One of the variables that has been encountered around the world is how difficult it can be to get a specimen. If you've had to get this test done, you know that it entails putting a nasal swab pretty far into your nose. Some people have described it as if it's almost touching your brain. Not everyone wants to go through with that, and so there is a little bit of a challenge in getting a good specimen. And that might account for why there have been concerns with the validity of the testing overall. It's not about the test so much, it's about how good the specimen that we get is. You asked a second question about a super spreader which we don't really use that term as much as we do an individual that we've traced a high number of cases to. What I can tell you is that all the credit for unlocking that and putting that puzzle together really does go to our disease detectives on the ground. I use that term detective sometimes, but this is a situation in which that really is what it was. It was detective work that they did in linking each and every one of these cases. Amy, you asked about whether that person was symptomatic or not at the time. We'll get you that information. I don't want to go into it right now. But what I do want to go into is the fact that when I use the term disease detective, what it really is being a detective and connecting these disparate pieces of evidence and putting it into one picture together. I'd like to turn next to Dan Newman at the Maine Beacon.
Thank you, Dr. Shah. Governor Mills, at the end of March, Maine accelerated rate increases for home care providers in order to increase wages for care workers.
Yes.
We've heard reports that some agencies have insisted instead use those that funding in other ways. Is there an enforcement mechanism to make sure wages are increased for home care workers? And is that something that your office is monitoring?
Commissioner Lambrew is here as well. We were insisting at the time that funding was enacted, appropriated, we continue to insist that it be used for line workers, direct care workers. I haven't heard the reports of it being diverted for other uses. Happy to take those reports, but we want that money to go to the direct care workers.
Turning next to Samantha Hogan at Pine Tree Watch. Samantha Hogan at Pine Tree Watch, go ahead.
There are a number of executive branch employees that are still coming into state offices as central workers. Can you tell me, are you considering sending any more employees home with pay, and why they weren't initially included in your stay home, stay healthy order?
Sure. I am so proud of the more than 12,000 state employees who have stayed the course, whether they're out plowing snow today or processing eligibility applications for Maine care, for health care, for investigating child abuse and neglect situations, or licensing folks, or looking into elder exploitation. So many thousands of jobs these people perform every day, every working day. I'm also proud at the rate of adaptation to this situation that those thousands of state employees have done. And I am proud to say that more than 85% of all state employees right now, excluding law enforcement, 24/7, 85% are working from home. Working from home. And those that are coming in, except for today because of the snowstorm, are spaced apart in spaces that are disinfected, that are kept sanitized, and where we do comply with all CDC health and safety guidelines. That's been the actions they've taken and we've taken. We have also expanded certain leave policies to accommodate the virus and to accommodate leave for other purposes than ordinary sick leave and vacation leave.
Turning next to Joe Lawler from the Press Herald.
Yes, thanks, Governor Mills, Dr. Shah. Dr. Shah, I was wondering, we noticed that the number of recoveries has increased. The growth rate has been pretty substantial over the past week or so, while the number of active cases has plateaued and gone down a little bit. Is there anything to make of those numbers? Is that any kind of evidence of curve flattening? And what do you think of those trends?
Yep. Joe's question is about whether we can read anything into the recent numbers about not only the number of new cases, but also the increasing number of recoveries. And Joe, I'm going to again say the three hardest words for anyone who is involved in a scientific endeavor to say, which is, I don't know. What we can hope, of course, is that these signs suggest that we are in the process of flattening the curve. But with any outbreak, you don't really know until the curve has flattened whether you were at that point on any given day when that flattening started to happen. So it really is too early to tell. But Joe, I want to focus on another aspect of this discussion of flattening the curve, because we all have in our mind this curve. And the reason we talk about flattening the curve is to reduce the strain on the healthcare system so healthcare providers can continue taking care of patients. And so what I also want to talk about, Joe, is not just the importance of flattening the curve, but also raising the line. That line that represents the available capacity of intensive care unit beds and ventilators. We've been trying to do both simultaneously. While we flatten that curve, we're also trying to raise that line, thereby increasing our capacity in the healthcare system. And so while it's too early to tell whether we flatten that curve, we have definitely raised the line and increased the number of potential ICU beds that are available, the number of ventilators that are available. And both of those in conjunction, I think, speak to the level of preparedness that we've got going on right now in the state. Before I turn to the next question, I'd like to turn back to Amy Brown's question about the event that we detected. And Amy, I had a very important follow-up note that is really critical. Each and every person that we have found who came into contact with this individual, Maine CDC has already reached out to several weeks ago. We've touched base with every single person that this person came into contact, as well as all the other people that those people came into contact with. So I just wanted to be very clear, this event happened quite some time ago, and Maine CDC epidemiologists were immediately on the phone with everyone that was in contact with that person. I'd like to turn next to Steve Missler at Maine Public.
Thank you, Dr. Shah. I appreciate it. I have a couple quick questions about the Tall Pines outbreak. It's my understanding that, I think you actually said this earlier in the briefing, that everybody there has been tested. My question is whether that was occurring before, because it's my understanding that that should have been happening, at least for people who were symptomatic. I guess to cut to the chase, was the facility, were they doing testing there prior to CDC coming in the midst of the outbreak? And if they were, do you know if and does the sudden surge of cases mean the protocol isn't as effective as expected? And should that change? Meaning, should they have been testing asymptomatic people? And then one quick one, can you give me a breakdown of the residents versus staff cases at that facility?
Sure thing, Steve. So Steve's questions are about the Tall Pine facility. That is one of our top concerns right now. And so, Steve, of the 22 cases, 19 are residents, 3 are staff. And then your other questions are about the facility's compliance and work on best practices. And so I don't want to go, a lot of those questions I think are probably better answered by the facility. So I don't want to go too far into the weeds, but what we understand is that the facility has been complying with all of CDC's recommendations. Some of your questions, Steve, contemplate what happened before the outbreak set in. And right now, the testing guidelines remain for any facility where there is no outbreak to be testing individuals who fall into the U.S. CDC's guidelines, which is to say folks who are in congregate care if they have symptoms. Now, once an outbreak is detected, one of the things that Maine CDC recommends is to test all people in the facility. That testing has been done. I don't have all of the numbers on that right now. I can say that of the tests that have been done on all individuals in the facility, symptomatic or asymptomatic, there have been 33 negatives. But for a better breakdown of that, we'll have to get you those numbers. Those are still coming in as the day has been going on. But thus far, we've worked really closely with the facility. This is a very challenging time for them, and they've been very willing to receive and put into effect Maine CDC guidelines.
Oh, that's great.
Yep.
And real quick, I'm sure you've seen this new paper out on changes on the basic reproductive number of the disease. I know that, you showed me some modeling earlier this week that shows that the infectious rate or the RO number is between 2.2 and 3.9, but this new paper suggests it could be much higher than that, 5.7. have you adjusted your models to account for that change?
So we've accounted for that, but, and so Steve is referring to a paper that was published in the Journal of Emerging Infectious Diseases, which is a journal that is associated with the US CDC, published by a group of extremely well-known modelers and mathematicians at the Los Alamos National Lab. And what differentiates their model from most all of the other models that have been created is they used a much different number called a serial interval. I'm not going to go into it any more than that. But what I think is important, Steve, is that there are a number of different papers out there now that project and look at different variables for R0, this number that we look at. This is just one of dozens now. We take into account all of those scenarios. So when we run our models, we run them with the lowest possible projections as well as the highest possible projections. This one is one of the ones that is on the outer boundary of high projections. And so it's one of those situations where do you use the number that most folks have looked at, or do you use the highest number that's been projected? And the answer is that we use all of it. As we've talked about, Steve, we run every model not for the sake of modeling, but for planning purposes, not for predictive purposes. I'd like to turn next to Sarah at the Machias Valley News Observer.
Thank you, Dr. Shah. First, can you comment on availability of the non-rapid COVID test kits? And secondly, here in Washington County, the known case count has held at 1 for 1 week. And I'm wondering if you can tell us how much testing is being done here. And if not in specific numbers, can you speak to concerns that not enough testing is being done here?
Great. So Sarah's first question is about the availability of testing. As of this morning, Maine CDC's laboratory here in Augusta has the capacity to run anywhere from 3,000 to 3,500 tests for COVID-19. We do that, we have that capacity because our laboratory staff has been very judicious about ordering more supplies well in advance to make sure that we don't have any stockouts. We do that also because we anticipate that there could be a surge in the volume and demand for testing. Sarah, your other question is about the testing levels in Washington County. I don't have those numbers in front of me right now, but what I do know is that we have worked with healthcare providers in Washington County so that they know how to draw the sample, how to take the sample appropriately, and how to send it to our laboratory for testing. Our laboratory is but one of now 7 laboratories available in Maine that offers testing. In addition to the Maine CDC laboratory, there are 6 other additional ones, 1 at a hospital and 5 commercial laboratories, all of which are available statewide. I'd like to turn next to Caitlin Andrews at the BDN.
Thank you, Dr. Shah and Governor Mills. I have a question for both of you. Governor Mills, have you made a formal decision about whether you're going to issue an executive order either on the evictions that people have been experiencing or about the formal election date for the June primary?
Yes. The question is about elections and evictions, not in the same order. But yes, we are looking at both of those issues. We've been drafting and redrafting the last couple of days. I have an executive order I'll be signing later today on moving the election, the primary election, from June 9th to July 14th, moving some other dates that are related to that election to accordingly. And we are drafting something on evictions. We are trying to carefully target that order to those cases, only those cases where someone is unable to pay the rent now, specifically due to unemployment, unexpected financial stress due to the COVID-19 virus and this crisis. And we were talking to the court system earlier last week about the issuance or non-issuance of writs of possession for cases that are pending, eviction cases or forcible entry and detainer cases. Secondly, I've been working with Maine Housing. We hope to announce a small program on Monday or early next week regarding some form of rental assistance, again, targeted to those who are specifically unemployed and under financial stresses, unexpected financial stress due to the COVID-19 virus crisis.
Thank you. And then my question for Dr. Shah is about congregate care. First, can you give us the formal name of the Augusta Rehab Center where the outbreak has occurred? And on the issue of Tall Pines, have you been able to figure out through contact tracing where the Tall Pines outbreak started? Also, are residents and staff being tested at that facility?
Great. So, Caitlin, we'll get you the official name of the Augusta Rehabilitation Facility and what they go as or how they do business as well, just so you've got that. Robert will get that to you ASAP. And then you asked questions about the Tall Pines facility and the nature of the testing there. Yes, all staff as well as residents are being offered testing. Now, in terms of what the investigation reveals, as with the Augusta facility, it's too early to tell how the outbreak may have started there. But based on data that the U.S. CDC has published looking at other long-term care facility outbreaks, the two most likely candidates are either a visitor or, in some cases, an employee who may have brought it in. Even if that employee or visitor was not showing symptoms, given the medically vulnerable populations in such facilities, it can take hold there. Again, it's too early to know exactly how any particular outbreak in a long-term care facility may have started. And according to the U.S. CDC, based on the dissection they've done of other outbreaks, we may never know, but our disease detectives are working on that right now. And then we'll get you the answers to the other questions so you've got them more officially. And the last question for today goes to Paul Dwyer at WABI. Go ahead, Paul.
Hi, Dr. Shah. Thanks for taking the question. Can you talk about how having confirmed community transmission now in Penobscot, or any county for that matter, affects the CDC's response there? Are there any procedures that you guys use specifically for these confirmed community transmission areas?
So Paul's question is really about the implications and the meaning of community transmission and how that might change any of our protocols. Again, community transmission is defined as a county in which there are at least 10 cases, 25% of which are not attributable to contact with another known case or through travel to an affected area. That is to say, community transmission means it's just going around in your area. It doesn't change our playbook at Maine CDC. It still means that we do investigations when those cases, for example, and some of the ones we've been talking about today, are in long-term care facilities. We still try to understand the source, and it doesn't change how we recommend testing or how we do our epidemiological disease detective investigations. It does, however, underscore the fact that coronavirus is here in Maine, it's all around us, and that every single person in Maine, no matter which county you live in, should go about their lives as if coronavirus were already there and not wait until your county is deemed to have community transmission, because by that time, it's probably too late. So I urge everyone to continue taking the precautions you've already been taking. Continue staying inside. Continue wearing face coverings when you're in public. Continue taking care of your family, irrespective of whether your county has been confirmed to have community transmission. Those are all the questions. Governor, I'd like to turn it back over to you.
Thank you. I just want to say thank you to Dr. Shah and to Commissioner Lambrew and to the several thousands of people who work in the department and who are supporting these two incredible state servants, public employees, and department heads, as well as Commissioner Fortman, who is working day and night to get through the backlog of unemployment claims, the unexpected burden on the phone system and the computers, and respect every one of those people who is trying to get through, and we will get to you. We will get your claim processed and get benefits out to you as fast as humanly possible. And I want to thank Commissioner Johnson as well, who's dealing with the business community, large and small, all across this state, and Commissioner Figueroa, who's dealing with state employee issues and budget issues and the like. And the whole cabinet has worked so tightly and creatively as a team, turning to address every aspect of this pandemic. And we hope to work with you in the coming weeks to flatten that curve and do whatever we can to keep every Maine person safe and healthy. Thank you for your courage, your persistence, your patience. Stick with us. Do your part, stay apart. Thank you.